Welcome to our January Health Equity Jam session. So as you all may know by now, I am Dr. Tanjala Purnell. I am an assistant professor here in the School of Medicine. I also have joint appointments in the School of Public Health. I'm also the Associate Director for Education and Training for the Johns Hopkins Center for Health Equity, which sponsors our Health Equity Jam sessions. And so we can go ahead and get started. We have a very exciting panel of experts who will talk to us today about addressing food insecurity to promote health equity. So we've asked everyone to prepare maybe about a minute or two to give us basically a highlight of the type of work that they are doing in this space and any burning information that they want to make sure that the audience knows about their work in this area before we get started with the questions. And so I won't pick on anyone. I will just ask. I could pick on Dr. Deidra Cruz just because she's looking at me. But anyone who would like to start is welcome to start.
Well, one thing that we invited as our guest, Dr. Berkowitz, as our guest to Baltimore and to Hopkins, we invited him to maybe kick us off and provide just at least a definition of what we're talking about today as far as food insecurity. So
sure.
I will turn it to you.
Yeah, so many of you probably know this, but so food insecurity is thought of as the limited or uncertain access to nutritious food owing to cost. It's measured by the U.S. Department of Agriculture in the U.S. As part of the, they use the Census Current Population Survey to measure it every year, and so there have been annual reports on the level of food insecurity in the U.S. going back to around 2000. Food insecurity encompasses a spectrum of situations people may find themselves in. At its most extreme can encompass what was previously called hunger, so actually you missing meals or losing weight due to not having enough to eat. At a potentially more mild but still impactful part of the spectrum, it can be simply worrying about whether you have enough to eat without actually changing your eating behavior. A quip that I sometimes use when I first started doing food insecurity research, I thought a lot of it was about the food, like what components of the diet people are or aren't eating. But I think over time I felt like more of it is about the insecurity, like the worry and not knowing where your next meal is coming from and changes to your behavior that you make when you realize that you may not have enough resources to meet your needs or your family's needs, and that can affect many other aspects of your life. So that's food insecurity as sort of caption of it, or at least as I think about it. Oh yeah, and so a lot of my work is around health-related social needs interventions. I'm a primary care doctor by practice. The food insecurity and diabetes are sort of a commonly studied area because of the clear connection between the two, and so I've worked on interventions that try to address this that range from the effect of the SNAP food stamp program on managing chronic disease, to providing medically tailored meals to people, to helping to link people to community resources like food pantries or things like that. So trying to study different ways to address these situations. Food insecurity is one of them, but often co-related with other issues related to poverty, issues with housing, transportation, interpersonal violence, medication affordability, and thinking about from a healthcare system perspective, how can we try to address these needs so that people can be healthier.
Awesome. Thank you.
Can I keep going? Okay.
Sure.
So again, I'm Deidra Cruz, and I'm a kidney physician, as was said. And my work really started off trying to understand racial and socioeconomic disparities in chronic kidney disease. And because we had observed that when individuals were both a racial and ethnic minority and also had low incomes, that we were kind of seeing this amplified risk of them having kidney disease. What then led us to kind of dive deeper and try to understand what is it about poverty or living in sort of under or with a low income that might actually ultimately influence a person's chance of developing kidney disease and other kind of cardiometabolic conditions. We really started focusing then on the diet and then understanding, around trying to develop an understanding around access to healthy foods, and that's kind of what led me to the space of food insecurity. And so our group was the first to document this association between food insecurity and kidney disease. And then around that time, we were also starting to look at what types of dietary patterns people who have low incomes and are either at risk or already living with food insecurity, sort of what type of dietary patterns they follow, and then trying to then understand how we might help those individuals to follow a more kidney-friendly way of eating that might lead to reductions in their chances of getting kidney disease or reductions in their risk of having their kidney disease progress to end-stage renal disease. And so we currently have a clinical trial that's ongoing called the 5 Plus Nuts and Beans for Kidneys study, which is one of the studies of the Center for Health Equity. That's a dietary intervention study for African Americans who have generally lower incomes and also have both hypertension and chronic kidney disease. And we're partnering with a local grocer here to provide what is effectively the same amount of food that is provided through the SNAP benefit, which is $30 a week worth of these helpful foods. And what we're testing is whether or not we can lower their prevalence of kidney damage, which has been found to be a way to prevent a person from going on and developing kidney failure. And so that's an overview of what we're working on.
Awesome. Thank you.
Great. And I'm Joel Gittelsohn with the Center for Human Nutrition and Global Obesity Prevention Center at the School of Public Health here. And my own work focuses on working with low-income ethnic minority populations around the U.S., primarily African American here in Baltimore City, but also American Indian, First Nations, Native communities elsewhere in the United States to increase access to healthier foods and to provide the supportive, I guess you'd say, education and other kinds of interventions and strategies that would support leading to reduced obesity, reductions in diabetes and other diet-related chronic disease. I got my start here quite many years ago, working on the very first trial with American Indians for obesity prevention in school children called Pathways. And that was a 9-year NHLBI-funded enormous trial that worked in 7 tribes. It was an incredible amount of work. There was a huge curriculum developed. There was brand new PE developed for the school for classes that was non-competitive and very active. There were changes to school food service. There was a family component, and after all of this work, it had no impact on obesity. And in fact, in the successive years of many different intervention trials that took place in schools, at least those that were centered primarily on within schools and did not include community engagement components, also had very low success rates, shall we say. So that led me to think about, well, if schools aren't the answer, at least schools not in and of themselves, how can we go outside the school and start working in the community? And so probably about 15 years or so, or maybe a little bit more than that, I began a series of studies and small intervention trials to work to change the food environment in the community. And in Baltimore, this took the place of, at least initially, working with corner stores. And as many of you know, corner stores are ubiquitous in the low-income areas of the city. There are over 500 of them. They are, they're not great sources of healthy foods, shall we say. And those foods that are there tend to be of low quality or maybe a little too pricey for customers. So how can we increase access to those foods? That work expanded to including into working with carry-out restaurants, recreation centers, and churches and other venues of that nature, and so has continued to expand. We have, as was mentioned in the introduction, a similar project working to reduce obesity through a multi-level, multi-component intervention with American Indian adults called OPrevent. So all of this work is the idea behind it is increasing access and improving behavior and health-related outcomes by working in multiple components of the food system. I would say that another aspect of this work that we've always been open to is are we working in the right places? And are there ones that we don't need to work in as much? And so we've more recently begun working in food pantries here in Baltimore City. We are looking into digital solutions to dealing with what I'm going to call the food distribution problem for small stores in Baltimore City, and maybe I'll say more about that later. And so we are exploring a lot of different avenues along those lines.
Awesome. Thank you.
Hi, my name is Alice Huang. I am a food access planner with the Department of Planning for Baltimore City. Some of my background is, when I started this job around 5 years ago, and I'd say in between that time, we started talking a lot about structural racism and racial equity. And we had a training that happened at our workplace. I think some folks here may have been part of that, talking about structural racism in the food system. And then pretty soon after that, everything around Freddie Gray happened, and the unrest, the uprising. And I remember our whole office coming together and feeling very upset. And people wanted to be out in community, people were crying. Like, I just remember my coworkers really just hurting for the city. And since then, we from the ground up, it wasn't a top-down approach, it's very much from people from the very lowest in our office. We wanted to create an equity working group. So from that, we started meeting as one person from every division in our office coming together, talking about equity, talking about how do we make a difference in our office. We did reading groups, we did trainings, we tried to bring more in, and we started to get the rest of our office on board to create an equity action plan. And really thinking about how racial equity impacts the way that we do our work. Thinking a lot about redlining and the implications of that in terms of how Baltimore is the way that it is now, and how are we exacerbating that, or how are we evolving from that? And I think that's been a really hard conversation. I don't think we have all the answers, but that's something we were wrestling with. So within the food world, that's something that we have also been trying to figure out. And so with that, we started a pilot program called the Resident Food Equity Advisors, because a lot of times we go out to community meetings and a lot of the dialogue is just one way. Either you're talking at people or people are talking at you, but there's not a back and forth. And we're trying to create an environment where we can have a deeper dialogue, a space for more transparency, for more collaboration, for more relationship building with people in community. So we ended up getting around 14 residents, one from every council district in our city, and we started talking to them about the plans that we're doing, getting their thoughts on how we approach our work. And so we keep evolving, we keep trying to figure things out. This recent term, we've been focusing particularly on corner stores. And one of the things that we saw with our applications, we asked, how do you feel like racial equity plays a role in corner stores? And it was so clear to me that there is tension between corner stores and community. A lot of folks who wrote in their application wrote, I feel like my corner store does not understand me. They don't know me, they don't know this neighborhood, they don't care about me, they don't speak my language, they don't stock the things that we need, they don't know what we need. And realizing there is actually a really big cultural barrier between majority of corner stores are owned by immigrants, and these immigrant store owners are in communities that are majority Black. And we realized that in order to talk about changing the food environment in these stores, we really had to start talking more holistically about these stores, talking about racial reconciliation, talking about how does race play a role in these conversations, talking about the built environment of these stores, not just what food they stock, but what these stores' infrastructure look like, looking at the zoning code. And so for us, we've been realizing that in order to address equity, we really need to start thinking more holistically, especially if we're thinking about how we want to change the food environment. There's so many other factors involved in that. And so that's some of the stuff that we've been tackling a lot with in our office, is just really thinking specifically around racial equity and how that really does play a role in the things that we do.
Awesome. And that actually ties into our first two questions that were submitted to us. So you asked whether there's a correlation between food insecurity and institutionalized racism. You also asked, how is the community addressing systemic racism in terms of food equity? And so we just heard, some excellent examples that hopefully will let you know that the answer is yes. There does appear to be a correlation, at least in certain settings. And we just heard some examples of some of the work that is being done here in Baltimore City. Are the examples from other panelists, or would you like to, highlight examples of other research or other work in this space that Alice has not already addressed in her introduction?
I guess I would just echo what Alice said as far as certainly around redlining. I was going to ask if you, because we have some younger trainees who may not know as much about redlining. Would you care to give them a good definition? And then, but go ahead.
Yeah, I will do my best to explain it. So I think what happened in terms of redlining was an initiative that happened across the country in terms of after the Great Depression. Folks were trying to figure out how do we help people afford houses and give them homes. And they kind of did a survey trying to assess the land, trying to assess property, like what's a good investment, what's a safe investment, where can people, like what's an okay place to give out loans. And in terms of looking at how people assessed the area and the region, you'll see they're color-coded by blue or green, yellow or red. Blue or green means this is a great area. We think this is a really good place to invest. If people who live here want to get loans, go ahead, give them a loan so they can apply and, so they can get mortgages and afford a house. And areas that were yellow were, questionable. We don't think this is this is a safe bet. And then areas that are red were considered, we do not recommend that you invest in these areas. And part of the factors that help them determine whether an area is red, yellow, or blue or green was race. So if an area was majority Black, it would be designated as red. If an area was transitioning, and by transitioning they would say like other immigrant groups or Jewish populations, that was yellow. And then if areas were predominantly white, blue collar, working class, they were considered great. You'd give the go. And so what happens is more and more of these white areas ended up getting mortgages. People were able to buy houses, and then with that, once they saw people owned houses, more development would come to these areas versus the areas where people couldn't afford to get houses, less development happened. So the wealthier got wealthier, the poor got poorer. There's a huge discrepancy between Black populations and white populations. And if you look through Baltimore City, you'll even see how areas were deliberately built to divide people. And so there's examples that, I think there's even an example of like there's areas where there's a mixed population in a neighborhood. And so in order to get the approval, these developers would create this large wall dividing the Black and white residents. And so the people now who lived in the white side of that area then would be approved to get loans, and residents who lived on the other side of that wall were not. And so it's very clear how the built environment that we live in now is reflective of the effects of redlining from then. And if you look at our maps now and where our vacant houses are and where our poverty is, it very much is the same as to where those red areas are historically on those maps.
Yeah, just to add, and I think one of the things that's really interesting, and there's a book if you all are interested in this topic further, called "Not in My Neighborhood," that I think is a worthwhile read about this in Baltimore. Actually, Baltimore ended up being kind of a model for this sort of behavior, and then other cities followed behind it. But I think it's clear that these structures were put in place certainly impacted, ultimately led to impacts on the food environment and the access to these more helpful foods in these communities that were partitioned off, really basically due to racial differences. And so, Sure.
Oh, sorry. I was also just going to add a little around some of the ways that you may connect food insecurity to institutionalized racism. So one way I think you can think about food insecurity is that it's sort of a functional assessment of income, meaning that if you're food insecure, whatever your level of income is, it's probably not sufficient to meet your needs because food tends to be a highly prioritized need. And so if you're not able to meet your food needs, probably in general, you're having trouble meeting sort of basic needs. In life. And so then the question becomes, well, why might certain communities, not have income levels sufficient to meet their needs? And I think that fits in very clearly with institutionalized racism. I think, income in the U.S. is highly patterned by race. It's highly influenced by education, which itself is highly patterned by race. It's highly influenced by the resources that went into child development and child health that enable you to grow up, be healthy, get well-paying jobs, take care of yourself and your families and things like that. And so I think sometimes you see with food insecurity the end effect of a whole system of kind of patterning what our opportunities are in the U.S. with race and ethnicity being sort of a clear input to how those things are patterned and how opportunity is distributed.
Absolutely. And along those lines, an audience member also asked, how are the city taxes and water bills helping to cause this problem? In particular, one of the examples was that many of the people in this city are seniors and are being strangled by these unjust fees. And so, we talked about the redlining. We talked about the city being built this way by design. How do all of these issues tie in together? How do the fact that we have people living in an area with lower incomes, less education, how does that influence property taxes and city water bills? And do we know whether there are direct efforts being targeted to try and to help address some of these issues and the role that they may be playing in food insecurity in this city? Sorry to look at you, Alice, but you're looking at me, so I'm going to look back. I think that's a good sign, but you don't have to answer if you don't want to. Okay.
I'll answer to my best of my ability. In terms of, water bills and city taxes, obviously, there's a lot of complex issues that go with that. And recently, I think there was a proposal to increase the water bill by 30%, I think was what they were trying for. And it was, yeah. And so I think what's really challenging with that, with seniors, and I will say if other people have other knowledge, please add to this, but I think there is some relief that comes for seniors within their water bills, but unfortunately what happens is you have to reach a certain age to be able to get that, and there's this gap in terms of folks who are in their late 50s, early 60s who may not have stable income, and yet they don't have that discount that's offered to them. And I think that is a concern that I think a lot of aging populations are having to address. And I think one of the issues here, not just with food, but just even having a home, people who can't afford to pay their water bill are losing their homes. And I think that's a huge thing that we need to be looking at, is just if someone doesn't even have a home and doesn't have that stability, how can they even have food security? I do know, I don't have answers, but I do have stories about how real this is. I got a phone call from a senior woman. She's in her late 50s and she's on medical leave, and she was sharing with me how she couldn't afford any food and she was desperate. And at first I was so confused what she was talking about. She's like, I need food and I don't know where to go. And I had no idea how she got my number. I'm like, I'm a policy office, I don't do programs. But she said, you don't understand, this has never happened to me before. She's like, I've never been in this place before. I'm so scared. My fridge is empty. I think this call happened 2 weeks ago. She's like, I don't have any food in my fridge. I have medical needs. I am getting treatment for cancer. I don't know what to do. And for her, she's like, I have to pay my bills, and I need to pay my bills, so I don't have money to buy food. And so I think often we forget that money has to go into so many areas of our lives, and there's bills to pay, especially if you're a homeowner, and understanding that food is this basic need that sometimes we don't think about. I think often when I talk to agencies, one of the things that we try to do is help agencies understand that food is an area that you should be looking at. I think people just think food is this normal thing, like everyone eats, so that's great, but often when you look at their areas of focus and their priority areas, food is never a priority area. And I feel like I always have to bring up to these agencies, hey, there's this issue about food security. Do you know whether or not your seniors have food? And how does food play a role in the people that you're serving? And I think often that gets kind of put on the side as a secondary issue because, especially with seniors, I think a lot of people talk about falls and seniors fall all the time. And I think that's important, but often when one area gets lifted, another area kind of fades. And for me, it's just realizing that we need to continue to emphasize the importance of food in people's lives and making sure that people do see this as an important issue for our residents in our city.
So just a corollary thing to say, we're in relationship to property taxes. Between, I think, in the early 80s to 2000 or so, there was between a 15 and 20% decline in the number of supermarkets in the city of Baltimore. I haven't seen the most recent data to show, but I know there certainly lost Stop Shop and Save, that whole chain, and I can't imagine it's done any more than stay steady at this point. And the property taxes are about double or triple here in Baltimore City than in the county. So you can understand why. I mean, it's a business decision, right? So, or at least part of its decision to move to a part in Baltimore County where you can save significant funds through lower property taxes.
So, and along the lines of supermarkets, we have another question asking how can supermarkets play a role in helping to distribute food to communities in need? And I know that Deidra mentioned her ongoing trial, but if there are others who would also like to weigh in to talk about, existing partnerships or potential ways that supermarkets can play a greater role in helping to address this issue of people getting food from corner stores solely and other issues related to access, then please weigh in.
I'll chime a little, and I think, Joel, you have probably the most experience around engaging these retail outlets for sure. But so one of the things, in addition, I think, to the provision of actual food, which is something we're kind of an approach that we're using in the context of our study that I mentioned, and a number of groups around the country, I think, trying to address this issue of food insecurity and thinking about its impact on particular chronic health conditions that are diet sensitive, and certainly in the case of someone with food insecurity, they may suffer from poor control of those health conditions, poor outcomes. Have tried these different models of partnering with grocers or with farmers markets and kind of other outlets. Some of the other, I think, some of the unique approaches as well is that some grocers actually now play a role in providing guidance around food purchases. For example, for their for SNAP beneficiaries who may shop at their store. There's some grocery chains that will provide kind of like a guided tour of a shopping tour, or which in some cases is actually a dietitian or someone trained by a dietitian to actually help those customers to make healthy choices on their budget that they have through SNAP. And so I think what I see is what we need in the future is more partnership from people on more of the academic and the healthcare delivery side, partnering with these grocers really to make sure that what is the advice that's being given is evidence-based from a kind of a medical and public health standpoint. But I think there is a lot of opportunity. It seems to be a growing amount of interest from some of these retailers, but I'll defer to others for more comments.
So the first thing I'd say about supermarkets is, of course, we need more of them. We need the ones that we have to take SNAP and WIC. Not all do. And I think that most people are aware that the typical supermarket in Baltimore City is very different from the typical supermarket outside the city or in the county, right? So what's the name of the chain, the other internal chain? It's not Stop Shop and Save that. It's wasn't ShopRite.
Save a lot.
Save-A-Lot.
The internet, yeah.
So if you've been in a Save-A-Lot supermarket, this is not your mother's Wegmans, right? I mean, this is it's a discount supermarket essentially, and I'm not saying that they don't have choices. They do have choices, but maybe not the best range of choices. So there's I think in a CLF study, actually that Manuel Franco did about probably a decade ago, he compared the supermarkets, the healthy food availability indices of supermarkets within the city versus outside the city, and it was something like out of 27 or 30 possible points, the ones outside the city got 27, 28, and the ones within the city got about 20. Better than a corner store for sure, but not not the full range of things. So we need to increase access both within in terms of total supermarkets, but also in terms of working with increasing the availability of healthier foods in the supermarkets that already exist. Just for those of you who might be interested, there's an interesting experiment that's going on right now, which is a supermarket called DMG Foods, or it's a grocery store, and it's run by the Salvation Army. It's their first not-for-profit, or actually probably the first not-for-profit retail food store that I've ever heard of. And they are selling food, but at substantially discounted prices. And the intention is to figure out ways to sell preferential. They carry the bad stuff. They carry chips and all that, but they are trying to figure out ways to preferentially, through pricing, through promotion or whatever, preferentially sell the healthier options in the stores. And I think there may be some lessons to be learned from this. The other thing is to think about, so why are corner stores, why are there 500 plus corner stores in Baltimore? And, they're not, if they were totally failing, they wouldn't exist. And many corner stores have, and I learned a lot of this from So-Hyun's presentation. So many corner stores have strategies or survival strategies, including giving credit, that make them, which I was unaware of before her presentation. But a certain number of them do give credit. A certain number of them have relationships with community members. It's not a monolithic sort of thing where all the corner stores are the same. They're all evil and that sort of thing. There's quite a range. Some are behind the plexiglass, some are open, some carry produce. Many do not, or not very much. Some have relationships with community members and have been around for 20, 30 years or more. And this is, I attest to, because I see they have bulletin boards with photos of kids, and kids who have grown up are now having kids and that sort of thing. They have these relationships with the community. So while I think that the long-term strategy is to increase and figure out ways to increase the numbers and the quality of the supermarkets that we have, I think we already have 500 plus retail food delivery units that are already in the lowest income areas of the city. And I think it'd be well worth our time to figure out a way to work specifically with those corner stores, essentially, that are already there. And I think, experience has shown there are ways to do this. It's not necessarily an easy thing, but there are ways to do this, and we need to think about how to, make that work.
Thanks, Seth.
So I can talk about just one program that I'm aware of in North Carolina, and this kind of puts it in a slightly different context because it's broadly in a more rural rather than urban area. So by way of background, people are probably familiar with this, but there's an experiment that the USDA did called the Healthy Incentives Pilot that offered a 30% supplement for SNAP benefits when spent on fruits and vegetables at farmers markets. And so you got your $100 a month. If you spent that amount on fruits and vegetables at a farmer's market, you got an additional $30 or 30% of that. And the experiment was quite successful. People increased their consumption of fruit and vegetables, about a 4-point increase on the Healthy Eating Index dietary quality score, which is sort of like the USDA's main index of dietary quality. But there's some issues with farmers markets, right? They're often not in all areas. They may only be open one day a week. In the middle of January, it might be hard to come by a good farmers market. So there's a program in North Carolina where they're partnering with Food Lion, which is a local supermarket chain that basically works the same way, a 30% incentive for purchases of certain fruits and vegetables, but is available at Food Lion. And so they've been able to tie into a large supermarket chain's ability to have produce available year round, to be located maybe not everywhere it need to be, but probably more commonly located than say farmers markets or something like that. But also be able to offer sort of a similar incentive to sort of change dietary quality. So remains to be seen how effective this will be. But I think it is a nice example of how, just as Dr. Gittelsohn is saying, take advantage of the distribution networks, the relationships, the fact that we already have an established infrastructure for these in some cases. Obviously, talking about corner stores rather than supermarkets in his case, but there may be ways to sort of partner with both private business and sort of public programs in order to reach communities that have been harder to reach, or even if you reach them, the individuals may not have the resources otherwise to buy these foods.
Great, and thank you for highlighting the role of farmers markets. I was also going to bring up the fact that I know that I've seen, here in this state, that some of the farmers markets also accept SNAP and WIC benefits. I've also seen that after the main farmers market, I think the one under the 83 bypass, I've seen some people come into the East Baltimore community and sell produce at a discounted rate. So I don't know, Alice, are you familiar with it? Did that come out of the Baltimore City Health Department? I was told that there was a grant that helped to facilitate that program. I don't even know if it's still in existence, but it was basically bring a bag and fill your bag up for $10. And I thought that was, really cool. But if it's no longer here, then I won't.
I can definitely share different programs that are available in the city. When we talk about different gleaning opportunities. There is the Baltimore Free Farm. They do free food giveaways, and that's something that they do where folks can come to an area and just get food, and they have specific locations where they do that. I know Hungry Harvest, they do produce in a SNAP, where you can get produce, like a $7 bag of produce. So especially for those who I think they target certain areas where there is need to give those away and to give discount prices. So I think there are programs around that are trying to provide discounted produce. And I also wanted to add, in the previous question about supermarkets, there are just thinking through being innovative with the role of supermarkets, because I think often we get a lot of residents who come to us and say, well, why can't we get a supermarket in our neighborhood? And, as much as I want to help make that happen, oftentimes we don't make that decision. The retailer makes that decision. They have these formulas that they put together and their own algorithms to figure out whether or not this is an ideal place to put a supermarket. And so as much as we want to influence and push that, and we have grocery tax credits that we've created as a city to try to incentivize stores to come into healthy food priority areas, but also understanding the need to be creative. And so thinking through things like the health department, they do a virtual supermarket where at senior and disabled housing facilities, people can order food online, and then those groceries get delivered weekly. And so right now with SNAP, you're not allowed to order food online with your SNAP benefits. But with this program, they bring the EBT machine to these facilities, and then they do the exchange in person so that they're not breaking any laws. But right now, there is a pilot that's happening through the USDA to try to get, I think right now in Maryland, I want to say Safeway and Amazon and maybe another retailer, they're looking at, they won the bid to start a pilot and explore these pilot ways of how do you purchase groceries online with your SNAP benefits. And we're hoping that that'll play out, hopefully, sometime in 2019. Obviously, with some of the timelines and how things are happening right now at the federal level, it's kind of a question mark, but we are thinking, what does it mean to work creatively with these stores, and even with rideshare programs. I know DC just recently started a rideshare program where I think you, just like for $2.50, you can get a ride to a grocery store. And so I think there are ways to creatively think about how to work with grocery stores to make them more accessible to different communities.
Awesome. So we're going to change gears a little bit, and you've been asked to describe what has been done to provide food security for our youth. And sort of combining another question, could you please discuss innovative ways schools in the U.S. or globally address food insecurity? So we've sort of heard what did not work, but are there programs that have worked? And the part two of this question is also what has been done to provide food security for our youth who do not attend school? So I won't pick on Joel, but I know you deal with schools.
So, well, I'll just say that in Baltimore, about half the food pantries are, at least that the food bank is working with, operate out of schools. And but they don't give food directly to the kids. It goes to the parents who come in, but they manage it through someone within the school food service or someone is responsible for managing this. So I mean, I think the schools have certainly played a role in addressing some of the food insecurity issues in the city.
Okay. Other thoughts, or would anyone else like to weigh in?
I mean, so I would say in general, though probably resources are never enough. I think food insecurity programming actually has a pretty robust amount of support for children in the schools. National School Lunch Program is the third largest food assistance program in the U.S. So first largest is SNAP, second is WIC, and third is National School Lunch Program. So that's been very effective. It's been expanded in many cases to a school breakfast program as well, which has been very useful. And then one positive development we've seen is more flexibility around either not means testing individuals. So if you're in an area that meets certain criteria based on poverty or other things, you can just offer school lunch and school breakfast reimbursed by the USDA for all students who attend the school without having to have an individual student, potentially face the stigma of saying, well, there's someone who qualifies, whereas someone else doesn't. So that's been very useful. Downsides of school-based programs, obviously, as mentioned, when people are not in school, either because they're just not attending school in general or because it's the summer and school's in session or something like that, doesn't reach kids there. WIC is extremely effective, probably has some of the best evidence in terms of health promotion of any food insecurity program, generally covers up to about age 5. So there can be a cut point there, but does help narrow the gap between before kids are old enough to be school age and provide some support. So, and WIC is actually sort of a globally leading program that's been a model worldwide. Is very effective, gives essentially a somewhat reduced bundle of options that people can purchase with WIC vouchers or by EBT, depending on what system the area is using. But that's been very useful in preventing things like anemia in younger children, good for prenatal care, leading to improved birth outcomes, et cetera. So those are probably the two largest federal programs that specifically address nutrition for children. And then also worth mentioning that SNAP is tied to household size. And so when there are more children, the benefit increases, although it probably doesn't increase quickly enough such that the incremental benefit of an additional child probably doesn't fully cover the increase in food cost of children. But so SNAP, even though it's not directly targeted to kids per se, a huge proportion of SNAP benefits do go to household with children in them. So I think the child area is actually probably one where there are a lot of programs. I don't think it does necessarily everything that needs to be done, but there is a fair amount focused there. And I think that's because of the well-established connection between early childhood nutrition and development. So it's, and sort of future life prospects and educational achievement and other things. So it's sort of an easier case to make about investing money there. Also, this is sort of an aside, but just as like an anecdote that I like to point out. So in economics, people often talk about the money multiplier effect. So if you invest $1 in something, what happens to that dollar? If it gets saved, then it's saved and say not just in a savings account, not reinvested somewhere, that's sort of pulled out of the economy to some extent. So it sort of lowers the amount of the dollar. But a lot of food programs, particularly SNAP and things like that, the benefits are highly likely to get spent over the course of the month. So that's money that goes back into the economy. The retailer who collects the SNAP benefit can then spend it on other things. And so most food and nutrition programs have a very positive money multiplier effect, such that resources put in often grow the economy to a greater extent than many other things. And particularly early childhood nutrition programs have a very robust money multiplier effect. And so not just for the health of the children, but for the health of the local community, these types of programs can be a very useful economic stimulus.
Awesome. I will ask one more question, and then I will ask you as the audience to let us know if you have questions in real time. If so, if you will plan to start moving towards one of the mics on either side of the room, we will build in time for you to ask additional questions. But the question that I will ask our panelists now is, what are some tips to increase stakeholder engagement? And just sort of adding on to this, we've talked about the role of supermarkets and corner stores and schools, but who are other key players if we are trying to address this problem, which obviously is an issue that we have to tackle from multiple angles? So who are some of the stakeholders that we have not yet mentioned, and what are the roles for those groups? And then we have a very dynamic group out in the audience. Are there ways that members of our own audience can help to support some of the existing programs that you've mentioned, or other work that we hope will come to fruition? So who are other stakeholders? And I think this is probably a question for everybody. Like, you all have friends, so who are your friends?
So I'll start. So I think a lot of the stakeholders, I think many of them have already been mentioned. One thing that I just wanted to add is I think we've focused a lot on access to food in general, certainly, and thinking about the programs that are addressing, they're targeting children. I think that I think there's two other issues I think worth considering. One is accessing or choosing with the benefits such as SNAP or WIC, choosing healthful foods, which I think there's a gap there. And even there was a recent article in, I think it was the new JAMA, the new Open Access JAMA journal that looked at that there's actually been a decline in kind of the quality of the dietary intake of people who receive SNAP, right? So it's not that one would hope that the provision of this benefit, which certainly helps to provide food, might lead to an improvement in the quality of the diet, but it's not going necessarily in the direction that we would like, although better than the quality was found to be better than those people who were eligible for SNAP but not receiving it. So it does appear to be doing something, but maybe not fully, it hasn't fully realized its potential. So I think that's worth considering. And then one of the things in some of our work in trying to promote fruits, vegetables, nuts, and beans, as we are in our study, is that we're finding that a lot of people actually don't know how to prepare these foods. And when we think about stakeholders, I think we need to engage, I almost want to say, grandparents to sort of bring back the traditions of food preparation, but also thinking about people who chefs and other folks who can actually contribute to actually even letting people know how they can, in a pretty convenient way, quickly prepare some of these healthful foods. Because I think we're at odds a bit with, certainly there's the cost piece, which we might be able to overcome with some of the programs we've already mentioned. But then there's this convenience factor that I think is really a real challenge for people. In some of our focus group studies, that's been a big thing that has come out is that people who have a number of chronic conditions, for example, where making a change in terms of their diet would definitely be beneficial from a health standpoint, really face a lot of challenges around overcoming the fact that it's really inconvenient to kind of eat in this way, even if given the provision of these benefits like SNAP. And so I think those are some of the things to think about as far as who we can engage to actually help people make the choices that would be helpful while also receiving those kind of financial benefits.
I think on my end, one of the things that we think about is who's not at the table. And recently we have this convening that happens quarterly called Food Pack. And we realized for a while that most of the people who were coming to these meetings were from organizations and nonprofits, but not really residents or community members. And we really found the group to be fairly homogenous. And we were trying to figure out, how do we diversify this group? And so because of that, we started thinking about, how do we change the time of our meetings to the evenings so that it's not just people who work in the field who can come, but people who actually have an interest for their communities can come. And we've been trying to change that up to bring even people who work for nonprofits, but smaller nonprofits, and to make sure that they're being given a platform to be able to share their work. And so I think one of the things that we are trying to think through is, who's not at the table and how do we give them a space at the table? And that's something that we are trying to think about more. And so now we're trying to move our meetings out of our office and rotating them throughout the city, and trying to find spots in the community that maybe people don't usually go to, and maybe bring in people to present that people don't usually hear from. I think the other thing to think about too is, a lot of times people don't think that their work is food related. I talk to a lot of community members and they're like, well, I'm here for like community neighborhood improvement, right? I'm here to improve my neighborhood. And it's like, oh, but we saw this need, and so we opened up a food pantry, or we did X, Y, Z. It's like, oh, you are working on food, And I think often they don't see, like what I was saying before, often food feels like this necessary piece, but people don't really categorize it as part of their work. And so really helping people to say, no, we want you at the table, and we want you to come because we think that you really are doing great food work. And so I think for all of us, it's really thinking about that racial equity question of, like, who are we really working with? And sometimes now when I go into rooms and meetings, I actually look at the faces in the room and try to think who's actually not there, and why aren't they there, and how do I get them there? And so that's something that I definitely think about.
Another group that frequently isn't there are the provisioners of food in the community. So the corner store owners, the carryout owners, the distributors, the wholesalers, the supermarket managers and owners, and all of those folks. And they really need to be there and to play a role, and to, I'm sure we could come up with some beautiful intervention which would probably quickly drive them out of business, and that's not acceptable either, right? So we need to understand their motivational structure. Yes, it's profit. Yes, it's making money for the most part, but there are also often secondary cultural motivational factors for why they do what they do. And some of this relates to spirituality, and some of this relates to their relationships with the community, and whether they have established those kinds of relationships with their community. Some of it relates to their role as immigrants, and the responsibilities and the sacrifice that they feel they are making for their children. And this is all part of their motivational structure for why they're here and why they do what they do. And we need to understand that and have that voice be part of the discussion.
Awesome. So, audience, any questions? Any burning questions? Miss Inez, I know you have a burning question. How did they do? Did they hairdresser?
Good. The one question I have is that we have food deserts, but however, it doesn't have to be a Whole Foods in the community, but it can be an Aldi's. And I don't understand why it can't happen.
All right.
So she's wondering why it's not, like, why can't an Aldi's come into a neighborhood?
Why can't, I said, can y'all hear me? No, it's not.
Oh, I can hear you.
Yeah, I was saying that in the food desert neighborhoods, and I live in one, but I can get in my vehicle and go to Whole Foods and go up to Hopkins and go to the Giant and so on and so forth. But we have some seniors, and believe it or not, they will buy if you have a real grocery store, supermarket in the community. People tend to think that because their income may not be six figures that they won't buy. But in the supermarket, regardless to what the income, they have to eat. And all I'm saying is that it doesn't have to be a Whole Foods or Trader Joe's, but it can be a Aldi's. That's all I'm saying.
Yeah. I mean, we definitely agree with you on that point, Ms. Robb. One of the things that we have talked about is the fact that a lot of times there is inequities between, there's so many grocery stores that choose to set up shop right outside the city. And it's really frustrating to see that. And so I'm definitely with you on that issue. I know that our colleagues at Baltimore Development Corporation and Kristen Dawson, that's something that they try to work on tirelessly. And I know I've even been with meetings with you, Mr. Robb, where we try to talk with developers to try to convince them that it is a feasible way. And I think one of the things that we're trying to figure out is how do we continue to increase community engagement in this process and to convince these developers that a grocery store is in fact viable. And, one of our resident advisors, they were even saying, I'm going to quote her, these are not my words, but she's like, there is money in the hood, that's what she said. And she's like, there is, the formal way that we count money does not include all the money that's in the hood. And she's like, I'm not saying that, everyone kind of lives a certain lifestyle, and there are certain people that actually have a good amount of money in these areas. And that money is not factored in these formulas that grocers put together when they think about whether or not a grocery store can open up. And so I do believe that there is a way to try to figure out better processes to engage community when a grocery store is considering coming into the city. And those are things that we're trying to explore. And we can talk more, Ms. Robb. I'm always here to listen.
Thank you. I think we have a question on this side, and we'll just kind of go back and forth on each side.
Hi, my name is Selby. Thank you guys for sharing your experiences and insight. You talked about your experience engaging with corner stores, but what about carryouts and fast food stores? What does the conversation look like with them, given their motivations and priorities?
So in Baltimore, there are, so first of all, just as ubiquitous as corner stores are carry-out restaurants and other types of prepared food sources. If you walk around the low-income areas just around here and you visit all of the prepared food sources, about 70% of them are carry-out restaurants. And so they're independently owned. They're not chains. So, there are about 10% of McDonald's and Burger King and all of that. But in fact, the majority are independently owned. About half are owned. The proportion of ownership by immigrant versus African American is a bit different, at least in the work that I've done. About half are owned by immigrant, and about half are owned, what we found, by African American or sometimes other kinds of other owners. It's actually far more challenging to convince a prepared food source owner to change what they do, how they cook, the things that they sell, than it is to convince a corner store. Maybe this makes sense because a carry-out owner probably has a menu of 30 or 40 items, but a corner store probably has 1,500 or 2,000 different items, and so it's not as big a deal for them to try out a few different things. But if you're asking them to change what they prepare, what they make, and so forth, this is challenging. We did a small trial with 8 carry-out restaurants, where in the first phase we redid their menu board for them, so it was a giveaway. And made them look nice, because typically they don't look all that nice. The second phase, we introduced healthy sides and beverages. And in a third phase, we worked on cooking methods with them. And we were actually successful in showing not only impact on customer purchases, but also on total sales, so total revenues, which is in fact far more important of a convincing sort of argument to make than getting customers to buy healthy foods per se. So that total sales went up. So I think there is some definitely traction to be made. If you look nationally, more, I would say that Actually, I don't know the national numbers. I think it's about a third of the calories consumed are consumed from prepared food sources nationally. But in Baltimore, it's a little bit more than half of the calories are consumed from prepared food sources. So this is really a ripe area to work. Maybe Alice could say something about the work that was done in public markets, working in food kiosks as a follow-up to the carry-out work. But yeah, I think it's definitely an area that we want to work in. There's been some legislation around this also.
Yeah. So after Joel's work around carryouts, we ended up trying to implement some of those pieces in the public markets in Baltimore City. So Baltimore City is one of the few cities that has a network of public markets. I think we have like 6 markets. And so we try to do some interventions there with the carryouts, trying to highlight what some of the healthier items are. And so, I mean, some of you guys probably go to Northeast Market sometimes, and we worked with some of those vendors. So part of the highlighting is the food that already exists that is healthier and encouraging them to promote those items more. And so we provided them with these boards. And I think what they did see is, people were buying some of those pieces more often at a slightly more at a higher rate than they were before. And I think one of the things was just, for us, I think one of the great things is talking not just about the intervention itself, but realizing that was actually a way for us to put our foot in the door and to build a relationship with the public markets and to continue to emphasize the need, not just for healthy carryout, but to make sure that food at public markets continues to be kept at an affordable price and that there is fresh food there. And so as we talk to these, to the Baltimore, the Public Market Corporation and Lexington Market, I think one of the things that they continue to hold to what they believe is, as they continue to renovate the markets right now, I think you hear that there's a lot of renovations happening with the public markets, that there will always be a place for fresh produce to be sold there. And they always believe in that, and they don't believe in converting these public markets into these what is it called? Food halls. That is the last thing they want to do with their public markets, and really valuing and appreciating the fact that that's something that they continue to strive for as they are redeveloping and trying to change the markets to be more modern and up to date.
To my left.
How you guys doing?
Hi.
My name is James Smith, and I work for the Baltimore City Health Department, Office of Chronic Disease. I manage the Virtual Supermarket program for the health department. And in managing that program and being involved with it for the last 5 years. So first of all, let me just say this real quick first. I'd like to thank you, Dr. Gittelsohn, for the work you've done in reference to, helping us identify these food desert areas through the mapping that you've done, and then identify, the work that we got to do with these corner stores. But in doing the work myself and working in the communities and, getting these programs up and running, one of the things that have always bothered and puzzled me was why we're not doing more to collaborate or bring the entities together to serve the communities. Okay, for example, we got the virtual supermarket, we got corner store initiatives, we got healthy, with the Hungry Harvest, food in the SNAP. We got the free farms. We got the food bank. What can we do to put together a more collaborative effort to bring to kind of coordinate this so that we can get all this working together in the community to make sure that we get those folks in food desert communities access to all the foods that they need in the community, along with, adding an educational component to it, especially for those folks in the community that don't know how to cook, like fresh, healthy foods. Because if the way I look at it and the way I see it, if we can get all this stuff together, we can have more of an impact in what we're trying to do to service those communities that we're servicing in those food desert communities. Any of you guys got any feedback?
Thank you.
Agree.
All right. So
I feel like I'm talking a lot. I feel a little self-conscious. Hi, Mr. Smith. It's good to see you. I agree. I think it's interesting seeing the food environment in Baltimore as it keeps evolving. I think when Holly Freisha, who's the food policy director, when she first started in the city, I think food was not necessarily a big topic quite yet. I think people wanted it to become a bigger topic. And so she came on board and she tried to bring people together in terms of, I don't know who all the partners are and who all the players are. And it was clear all these people were playing in different fields. And, someone on the east side might be doing a project and it's like, oh, do you know someone on the west is doing the same exact thing you are? And how do we bring you all together? And how do we break down silos? And as we started doing that, I think the momentum kept building and people started working together and figuring out, we're all working on this thing. Let's try to work together on it. And now when you look at Baltimore City, there are so many people who are working on food, and that we're kind of going back to that place now where all of a sudden there's so many people who are working on it that now everyone's back in their silos again. Right. And everyone's trying to work in their specific field, whether it's nutrition education or food retail or, et cetera. And so that's where we realized actually we need to work on breaking down those silos again.
It's all interconnected.
Yeah, and figuring out connections. And I think that's one of the things that with Food Pack, that's what we're trying to work to do better and to improve is figuring out how to break down those silos better. And one of the things that we realize is as people keep doing the work that they're doing, no one wants to be, not no one, but it's interesting how to help people collaborate when everyone has their own agenda or their own values or their own goals to achieve. And so, as much as I would love to launch a working group at Food Pack, realizing that I'm not here to impose my agenda on these folks, but how do we really see what happens on the grassroots wise and what people want to do and see how those pieces can come together. And I think that's what I'm trying to do right now with Food Pack and trying to figure out identifying the partners and figuring out who wants a working group, who wants to start one, and then can Food Pack be a space for them if they want to do that. But I agree with you. I think often right now it's very clear that there's a lot of silos kind of working on these issues and trying to figure out how do we break that. And also, as we were talking about, we were having an equity conversation at our last Food Pack meeting, and people were struggling. They're like, we keep competing against each other for grant funds, everyone's competing. It's like, why are we competing against each other? Why can't we actually work together? And I think that's something that we need to really think through is for people who are applying for grants, I think we also need to think about racial equity in that process is if I'm applying for this grant, am I working with someone in the community so that we're both benefiting from this grant? If I am applying for this grant, who am I taking money away from? And I think those are questions that we have to ask as well, and just the resources that we're trying to share. But Mr. Smith, I definitely echo your sentiments for sure.
Awesome. Thank you both. Okay.
Good afternoon. I'm Patty Dash, the Executive Director for the National Kidney Foundation. Shameless plug, the wonderful Dr. Cruz is on my board of directors, so we love her. And Joel, I worked with you when I was at Girl Scouts, so hello again. So some of what was said I was going to frame, but I think part of what I'm looking at here is one of the many services that we offer is a patient emergency assistance fund for patients who have kidney disease. And so when you're on dialysis, you can apply for funding one time a year, up to $200. And so some people think, well, that's not enough money. And so we've been having conversations about, do we raise it to say $500 per patient per year and have a greater impact? And so one of the things that, I wanted to ask was, we're working with a grocer, I won't name, and we're purchasing these gift cards that we give out to our patients. And so they give us no discounts. They have no skin in the game. They're like, okay, you buy from me, and that's great. So, we're sending business their way, obviously, because it is a major grocer, and it's in the majority of the communities. The majority of our funding for this patient emergency assistance program goes to transportation to and from dialysis, and then number 2 is food. And so this could be for a 30-year-old This could be for an 80-year-old. The age ranges greatly. And so some of what our dialysis patients say to us is, I have to make a tough decision. Do I put food on the table for my family, or do I buy my life-saving medication I need to live? And or other things. So my question really is, again, we are all vying for the same funding. We are, we should be looking at partnerships on how we could collaborate on joint grant opportunities. So my question really is around how do we get the grocery vendors, if you will, and or other organizations to work with us? Because again, I know any nonprofit will tell you that they're vital in the community, but without your kidneys, you die. That's the reality. And so, I'm just looking for how do we raise that awareness, and how do we get folks who are selling that food to work with organizations like us and have some sort of, partnership with us in doing that. So just thoughts.
Yeah, I guess I'll comment. Just because you said kidney. No. I'll comment. Yeah, I think, I definitely think it's challenging. And I think making for the individual retailers, obviously awareness around what condition they're sort of helping support. But I think as we share with them some of these models where other retailers are contributing in this way, and where, and I'm pointing to Seth because he does a lot of work in this area, but where health systems are also contributing. I think in the cases where, like in kidney disease, where we're trying to support a patient population that incurs a lot of healthcare expenditures, that there are potential incentives for the system that is providing their care, I think, to step in places where maybe some of the retailers aren't quite ready to step in around this issue of food access. And so I think, there may be some opportunity there as well. But
all right, and we have, I guess,
she's going to cut us off, because we have to go to
I'm just looking at the time and know our reception is up. So Maya, please ask your question, but also David, I know you were waiting patiently, so maybe you both can just ask your questions, and then if our panelists don't mind, we can just see if they can address both, and then we'll wrap up.
Okay. Hi, everyone. Maya McDoom, a former trainee here at the Welt Center and also with the Equity Center. I think one issue that I notice a lot when we have this conversation about like social determinants of health and equity and thinking about the community, we conflate the issue of meeting individual social needs versus actually implementing on solutions at a community level. And I currently work for a commercial healthcare payer, and we are now starting to think about this issue of like, how do we address the needs of our members? And how do we do that by reaching out to the community? So one, I'd like your perspective on what's the role of healthcare, payers in this space? And two, like, how do we prioritize some of these issues in terms of, are we meeting individual social needs, or are we actually looking at the policies and the conditions in these communities to actually implement change on a broader level? And then two, really quick, do you have any ideas in terms of strategizing for urban versus rural communities? Thank you.
Great. David?
All right, so my question was a little bit different, but I know a lot of you guys have worked in the education of healthy foods, healthful foods, and diet. How much do you think that the misinformation that's promoted in the media, in documentaries, and there's a lot of credible sources that quote unquote credible out there that are saying certain things that are very conflicting with other sources of information. How much do you think that sort of misinformation plays into the conversation of food inequity and also just health inequity? And how might the big food companies, their power and influence be sort of inhibiting our work in this space, or is it?
So several provocative questions, and I turn to my experts to address these.
Sure. So I can talk a little bit about the first question. So I do think it's an important distinction to make between, individuals who may have specific needs right now, and then sort of the larger, community patterns and policies and things like that put individuals at risk or lead individuals to experience these needs. And I think it's worth intervening on both. I mean, I think in some ways you can think about this similar to a prevention versus treatment type paradigm or something like that. There are people with real needs now who are suffering, and so we should try to address that. We should also try to stop the situations that are bringing about these situations. And so I think both are very legitimate areas to work in. I do think payers have been playing an increasing role in this field, and I think that's great. I think they recognize that obviously social factors are key determinants of healthcare utilization that people may have and directly affect sort of the lines of business that payers are in. I think in some situations this dovetails very nicely. There can be wins where people are healthier and thus use fewer healthcare services, and this works well for payers. I do think there can be some situations where what payers prioritize may not be what is prioritized in other areas, and it can sometimes lead to sort of somewhat unusual situations. So say you had two people, both food insecure, both were in situations where food insecurity might impact their health, but one had end-stage renal disease such that their food insecurity was going to cause them to need an emergency dialysis session that would be very expensive. Another was a young child where in the long run food insecurity would lead them to not reach their full potential, have a less well-paying job, contribute less to society. From a payer's perspective, you clearly want to put your effort into the person who's going to have high short-term costs, a payer could argue that. Other people may make good cases that you either want to put your efforts into both or put your efforts into children because it can have a big long-term payoff over a lifespan horizon. And so I think we need to be cautious. Now, there may well be some payers that do want to take this more of a lifespan perspective. They recognize the value of prevention, et cetera, but it's not necessarily a given. And so I think we want to work together when possible, but I don't think we want our decision-making to be fully driven by, return on investment or sort of short-term cost savings or something like that, because it could distort some other valuable outcomes that we could pursue.
Mm-hmm. I could comment on the media information, the misinformation piece. So I think that's a big challenge as we think about what for those individuals who have food insecurity and who we're trying to sort of provide this provision of access to these foods, thinking about then the purchases that they will make and the foods that they will eat. Certainly that definitely is a challenge. There's a ton of misinformation out there, some things that in some clinical situations are just not even safe. And so I think this is why I'm certainly advocating for more of a focus around the education piece of things, around that it's not just providing the money or providing the food, but we have to really help people to understand how they should sort of go about making the behavioral changes that they want to make to improve their health. So I think that's a big challenge.
Well, again, please join me in thanking our panelists for dynamic discussion of today. Thank you all. And if you are available, we invite you to stick around. We have a reception in the Sheldon Gallery area, I believe is what it's called. So just right outside and right where the monitors are, and we look forward to continuing this conversation and to also seeing the example of the first aid kit from around the world. So perhaps we can catch up with Joel at the reception. So thank you all for coming, and we look forward to continuing the conversations.